Just because they're coming to me doesn't mean that I'm going to push a medicine on you. I am not someone that believes in like we need to throw medicine at people. No, there are people that come to me that when I meet them and we talk through the different kind of treatment options, that I will straight up tell them, I do think potentially the best option here is for you to pursue therapy. For most people, I will recommend no matter what, but some people I only recommend that at this point, I think a medication wouldn't serve you the best. Like, we can continue to explore that and talk about it. And if you really feel strongly that you think a medication would be helpful for you, like, let's understand that and let's think about it. But not everyone needs to be on medicines, and just because you go to a psychiatrist doesn't mean that you should have medicines thrown at you and that you should be trying to convince those people to take meds, because that's just not what you should be doing. That's not what you're here for. You're here to provide someone with information and to help them better understand what their options are. Sometimes those options are, have really low like vitamin D levels or really low like B12 and you need to take a vitamin, and that could really be a huge impact on your mental health. There are some things that are as simple as that. A lot of people want to see a psychiatrist that isn't going to just treat them as this number where they're coming in, they're spending 10 minutes with you, and then they're pushing you out the door. They need to have a psychiatrist that wants to understand them and get to know them and hear their story. Because if you don't hear someone's story and you're just basing it off of straight up like, this person come in with depression. Everyone's depression looks very different. There are all different kinds of symptoms about every person's individual kind of experience that can help you guide, okay, which medication options might be the best for it? What type of therapy could potentially be the best for this? And so having an understanding of, there is a lot of variability here, I think is another reason that folks want to come with me, because I will talk through that and I will spend an hour in our first appointment to really get to know you and let's come up with a game plan together about what potentially could serve you the best and what could be something that doesn't have a ton of side effects, because we don't want that either. We don't want to load you up on stuff that's going to numb you up and not feel like you're